Gastroesophageal reflux disease, or GERD. It has now become a very common condition that you can hear among people, even the young, talking about this disease and personally experiencing them. It is a concept that includes a related condition caused by the gastroesophageal reflux resulting to a troublesome symptoms, either esophageal or extraesophageal manifestations. The spectrum of injury can be as simple as esophagitis to strictures, Barrett's esophagus, or even adenocarcinoma. Among the subset of GERD, esophagitis would be suited to define its pathophysiology. It occurs when a reflux gastric acid and pepsin cause necrosis of the esophageal mucosa, causing erosions and ulcers. Esophagitis results from excessive reflux with impaired clearance of the reflux gastric juice. The mechanism of esophagogastric junction incompetence includes a transient LES relaxation. It is a vagovagal reflex in which LES relaxation is elicited by gastric distension, LES hypotension, or anatomic distortion of the esophagogastric junction, inclusive of hiatus hernia. Normally, acid reflux occurs even in normal people. Peristalsis returns the reflux fluid to the stomach, and acid clearance is completed by a titration of the residual acid by bicarbonate contained in our swallowed saliva. Factors affecting the reflux include increase in intra-abdominal pressure, such as seen in abdominal obesity, pregnancy, or factors that are related to increase in contact time or increase in acidity, such as in gastric hypersecretory states, delayed gastric emptying, disruption of esophageal peristalsis, and of course, to include gluttony. What are the harmful elements to the esophagus? We have the gastric juice, which is harmful to the esophageal epithelium. Also, the pepsin, bile, and pancreatic enzymes within the gastric secretions can also injure the esophageal epithelium. But their noxious properties are either lessened in an acidic environment or dependent on acidity for activation. The bile, it persists in refluxate despite acid-suppressing medications. That's why you can see some people or some patients can have a persistent symptoms even with proper treatment with antacids or PPI. Bile can traverse the cell membrane, imparting severe cellular injury in a weakly acidic environment. The symptoms, you can have a heartburn and regurgitation, which is a very common symptoms. And the less common symptoms are dysphagia and chest pain. We have some symptoms that are related outside the esophagus, which are chronic cough, laryngitis, asthma, and even dental erosions. Complications are related to chronic esophagitis, the bleeding and the stricture, and relationship between the GERD and the esophageal adenocarcinoma. Barrett's esophagus. Barrett's metaplasia can progress to adenocarcinoma through the intermediate stage of low and high-grade dysplasia. Areas of mucosal irregularity should be extensively biopsied in patients presenting with this kind of problem. The rate of cancer development is estimated to be 0.1 to zero point 0.3 per year. The management remains controversial. Esophagectomy, intensive endoscopic surveillance, and mucosal ablation have all been advocated. Mortality in esophagectomy range from 3 to 10%. It is associated with substantial morbidity. The treatment, which involves lifestyle modification. Lifestyle modification has three categories. Number one is avoidance of food that reduce lower esophageal sphincter pressure, making them refluxogenic. They include fatty foods, alcohol, spearmint, peppermint, tomato-based food, and coffee and tea. Avoidance of acidic foods that are inherently irritating, and adoption of behaviors to minimize reflux and heartburn. We have pharmacologic approach. These are inhibitors of gastric acid secretion, or reflux symptoms tend to be chronic, irrespective of esophagitis. We have the proton pump inhibitors, H2 blockers, and alginates. Laparoscopic Nissen fundoplication. This is our surgical procedure wherein the proximal stomach is wrapped around the distal esophagus to create an anti-reflux barrier. It is a surgical alternative to the management of chronic GERD.